Depression is a common mental health condition that affects millions of people worldwide. While it can be a difficult and challenging experience, there are many ways to manage and overcome depression. In this video, we'll explore the common causes of depression, the types of therapy that can be helpful in treating it, and practical steps you can take to prevent and manage depression. Whether you're struggling with depression or know someone who is, this video is packed with valuable insights and actionable advice to help you take control of your mental health and improve your overall well-being. What is a depression? Depression is a mental health disorder that can affect a person's thoughts, feelings, and behaviors. It can cause a persistent feeling of sadness, loss of interest in activities, and a variety of physical symptoms. Depression can be caused by a combination of genetic, environmental, and psychological factors. Some of the common symptoms of depression include feeling sad or hopeless, loss of interest in activities once enjoyed, changes in appetite or weight, sleep disturbances, fatigue or loss of energy, feelings of worthlessness or guilt, difficulty concentrating or making decisions, thoughts of death or suicide. If you or someone you know is experiencing symptoms of depression, it is important to seek help from a mental health professional. Treatment for depression may include medication, psychotherapy, or a combination of both. Here are some of the most common causes of depression. Genetics. There is evidence to suggest that depression may run in families. Research has identified certain genes that may increase a person's risk of developing depression. Brain chemistry. Chemical imbalances in the brain, particularly imbalances in neurotransmitters such as serotonin and dopamine, have been linked to depression. Environmental factors. Stressful life events, such as the loss of a loved one, financial difficulties, or a traumatic experience, can trigger depression. Medical conditions. Certain medical conditions, such as chronic pain, cancer, or heart disease, can increase the risk of depression. Substance abuse, including the misuse of alcohol and drugs, can lead to depression. Hormonal changes in hormone levels, such as those that occur during pregnancy, menopause, or thyroid problems, can trigger depression. Treatment for depression usually involves a combination of medication, psychotherapy, and lifestyle changes tailored to the individual's specific needs. Psychotherapy, also known as talk therapy, is an effective treatment for depression. Here are some types of therapy that may be used to treat depression. Cognitive behavioral therapy, CBT. This type of therapy helps individuals identify and change negative thought patterns and behaviors that contribute to their depression. Interpersonal therapy, IPT. This therapy focuses on improving relationships and communication skills, which can help individuals better manage their depression. Psychodynamic therapy. This therapy helps individuals explore their unconscious thoughts and emotions to gain a deeper understanding of the root causes of their depression. Mindfulness-based therapy. This therapy teaches individuals to be more present in the moment and develop skills to better manage stress and negative thoughts. Group therapy. This therapy involves meeting with a group of individuals who are also experiencing depression. It can provide a supportive environment and a sense of community. It's important to note that therapy is not a one-size-fits-all approach, and what works for one individual may not work for another. It's also common for therapy to be used in conjunction with medication, lifestyle changes, and other forms of treatment for depression. If you are considering therapy for depression, it's important to speak with a mental health professional who can help determine the best approach for your individual needs. There are several things that can be helpful in preventing or managing depression. Here are some things to consider. Take care of your physical health. Engaging in regular physical activity, eating a balanced and nutritious diet, and getting enough sleep can help improve your overall well-being and reduce your risk of depression. Build a support system. Cultivating healthy relationships with friends, family, and other supportive individuals can help provide a sense of connection and reduce feelings of isolation. Manage stress. Learning effective stress management techniques, such as mindfulness, meditation, or deep breathing, can help reduce stress and prevent depression. Limit alcohol and drug use. Alcohol and drugs can increase the risk of depression and make symptoms worse, so it's important to use them in moderation or avoid them altogether. Seek help early. If you are experiencing symptoms of depression, it's important to seek help from a mental health professional as soon as possible. Early intervention can help prevent symptoms from worsening and improve your chances of successful treatment. It's important to note that everyone's experience with depression is unique and complex, and there is often no single solution that works for everyone. If you are struggling with depression, it's important to speak with a mental health professional who can help develop a personalized treatment plan that meets your individual needs. While there is no single best advice to avoid depression, here are some general tips that may be helpful. Practice self-care. Taking care of your physical and mental health is essential for preventing depression. This includes eating a healthy diet, getting enough sleep, engaging in regular exercise, and practicing relaxation techniques such as deep breathing or meditation. Build social connections. Having a strong support system is important for mental health. Make time for friends and family, participate in social activities, and join groups or clubs that interest you. Manage stress. Chronic stress can increase the risk of depression. Identify sources of stress in your life and learn effective stress management techniques such as time management, problem solving, or relaxation techniques. Challenge negative thoughts. Negative thinking patterns can contribute to depression. Practice identifying and challenging negative thoughts with more balanced and realistic thoughts. Seek professional help. If you are experiencing symptoms of depression, it's important to seek help from a mental health professional. They can provide a diagnosis, develop a personalized treatment plan, and offer support and guidance throughout the recovery process. Remember that everyone's experience with depression is unique, and what works for one person may not work for another. If you are struggling with depression, don't be afraid to reach out for help. With the right support and treatment, depression is a treatable condition. Thank you for watching our video on depression. We hope you found this information helpful and informative. If you or someone you know is struggling with depression, remember that help is available. Reach out to a mental health professional or support group to get the support and guidance you need. By taking care of your mental health and seeking treatment when necessary, you can overcome depression and live a fulfilling life. Don't forget to like and subscribe to our channel for more valuable insights and advice on mental health and wellness. Once again, this is Mr. Junro. Thank you for tuning in.